Let's review fluid regulation, fluid volume deficit. How do I know if my patient has fluid volume deficit? Signs and symptoms of fluid volume deficit include thirst, lethargy, anxiety, headache. These are subjective signs. Remember, this is what the patient tells you. Objective signs is what you as the nurse observes. These include fever, rapid pulse, hypotension, decreased urine output, urine with a high specific gravity, increased H&H in your labs, and confusion and disorientation. But what causes fluid volume deficit? Many factors could cause your patient to lose fluid, including vomiting, diarrhea, GI suctioning, insensible fluid loss through sweating and coughing, decreased fluid intake, intake of caffeine and alcohol, fevers, certain medications such as diuretics, and remember, the elderly and infants are at higher risk for dehydration due to altered sensory perception. How would I manage a patient who is in fluid deficit? Priority intervention is to replace fluids. The best fluid to give is an isotonic fluid such as LR or 0.9% normal saline, keeps the fluid in the vessel. Monitoring your intake and output hourly. Daily weights. Remember, 1 liter of fluid is equal to 1 kilogram of weight. Monitor the vital signs, which will be your pulse and your blood pressure. Reassess your skin turgor and your urine specific gravity. Now that you have some knowledge about fluid deficit, let's apply it. Which of the following patients is at greatest risk for developing deficit fluid volume? A. A 60-year-old male who had a heart catheterization about 12 hours ago. B. A 60-year-old female who is NPO after a colonoscopy procedure. C. A 76-year-old female who has an NG tube on intermittent suction, status post colon resection. Or D. A 52-year-old female receiving antibiotics and prednisone for bronchitis. So what do you think? Feel free to pause this video for more time. Let's review the rationale. Patients A and B would not be at high risk for dehydration or fluid deficit because they had minor procedures and surgeries, and their oral intake would be resumed right after. Choice D, the fact that she's on a steroid would actually make her retain sodium and water and therefore would put her at risk for more fluid overload. If you chose option C, you are correct. This client has more risk factors pointing toward fluid volume deficit. She's elderly, she's losing fluid by the NG tube, she is NPO, she has no intake, and she's also post-operative major surgery. You did a great job. Let's try another example. Your patient is admitted to the medical floor with gastroenteritis due to food poisoning. He had many episodes of vomiting and diarrhea. His blood pressure is 86/45, his heart rate is 118 beats per minute, and the client is feeling weak. What nursing diagnosis is priority for this patient? I know. He has deficit cardiac output related to decreased circulating blood volume as evidenced by his heart rate of 118. Good try, but remember the problem is not a pump problem, it's not a heart issue, it's a fluid issue. So deficit cardiac output would not apply in this case. Okay, how about Imbalanced nutrition less than body requirements related to vomiting and diarrhea as evidenced by weakness. I see that you're thinking, however, nutrition would not be priority in this case. I think I got it. Would it be deficit fluid volume related to nausea and vomiting as evidenced by a blood pressure of 86/45 and a heart rate of 118? Yes, you are correct. Excessive vomiting and diarrhea causes dehydration, and we could see that reflected in the low blood pressure and the rapid heart rate in order to compensate for the volume loss. Great job, my future RNs. Remember to like and subscribe to this channel, and don't forget to press that notification bell so you'll be notified whenever a new video comes out. See you soon.